Well, hello. Good morning, good evening. Whoops, good afternoon and good evening. My name is Josephine Roach, and I am so excited that today me and my good friend, the Reverend Dr. DivaDee, will be interviewing one another. And of course, we picked October because October is Breast Cancer Awareness Month. We planned this at the beginning, but we thought we'd go out with a bang and do it at the end. As most of you know, October is Breast Cancer Awareness Month, and both me and Dr. DivaDee are breast cancer survivors. So we wanted to come on today and discuss some of our story and some of the things we went through, some likenesses, some differences, and we're just really happy that you're here. Reverend Dr. DivaDee, I was thinking about this and how long have we been friends?
Oh my, that is a good question. I think when we did our book together is
Okay.
is when we do you have that book?
Yes, I do. I do have this book. We were in an anthology together. And for those of you who do not know, and an anthology is many people writing chapters in a book. And this was our book, Unlock Your Hidden Treasure. It's time to shine. And that's what brought you and I together
Yeah.
because we each wrote a chapter in Dr. Mary Seeger's anthology. So we were brought together then and we each wrote different chapters. So we're both writers. So that's exciting. That's something we have in common. You'll see some common threads as we go through our talk today. We're both writers. I also wrote my own book back here on breast cancer, Josephine's Journey, a breast cancer survivor's story of hope. And we'll talk about that too a little later. But what I want to talk about now also is I think D, I'm going to call you, I'm sorry, I'm calling you D, but I know it's very exciting. I want Reverend Dr. DivaDee to tell us how exciting, how she came about with, I'm just so excited and want to congratulate her with all the accolades that she has received this year. So why don't you tell us a little bit about what you've been doing this year and how you acquired such a notable name?
Okay. So let me start with my good morning. So this is how I always start. And I try my best to include everybody around the world. Good morning, good afternoon, good evening to my kings and my queens, my brothers and my sisters. And I want everyone to know that you are welcome. This is a safe space. Now, my journey, I want to back up just a little bit. My journey last year, I started, I went back to school. Now, I'm not quite sure why I did that, but
It's never it's never too late to go back to school.
that was the hardest thing. You are in a classroom setting with people your age and down. Somebody that's 25 years old, 35 years old. I am 66, but I did it. Oh my gosh. And they honored me at school and they gave me the Presidential Community Service Award. And I want to shout out Kingdom University Institute. Oh my goodness. It was an awesome journey. And I was afraid. I really was afraid. It was an awesome thing, but I felt like people was going to judge me and going, what is she doing here? What is she doing? And that's how I feel in this walk that me and you have taken. Any other disease, any other cancer besides breast cancer, people don't judge you. They go, oh, okay, congratulations or whatever. But when you say, I'm a breast cancer survivor, they immediately look to your breast. What is that about? Why do you think that you can see through my clothes? Couldn't you just congratulate me? My other sisters and brothers, because men get breast cancer too, they experience that same thing. And we have to educate people. And that's what we're trying to do this morning. Yes. And why do we call each other? Here's my question back to you. Why do we call each other twin?
Oh, well, I know you coined the term, but obviously, twin means you have lots in common. And initially, when we first met, obviously we wouldn't know the things that we had in common. But as we have went along and got to know one another, it was amazing all the things that we had in common besides breast cancer. One of the things that I know that we have in common is that we both love Prince. I know that. And we both love the color purple. And I also know that I know you love big time wrestling. And then I shared with you that my father was a huge big time wrestling fan. So that was another thing we had in common. What else? What else?
We are very, very passionate about our writing,
Hmm.
very passionate. We take that with the serious, utmost care. When we research things, we want it to be exact.
That's
We do
right.
not care for other people's opinion about how we feel and how we move about the world. How you feel out there has nothing to do with how I feel today and
Hmm.
how I went through this journey.
That's right.
And two of us will just sometimes it's 12:30 at night and I go, okay, I'm having an issue. And I know that I could reach out to you and I don't have to explain to you how I'm feeling.
Hmm.
And you pick up, you go, something's wrong.
That's
So
right. Hmm.
connection is a lot emotional. And I celebrate you being my friend throughout this
Hmm.
journey.
Yeah.
And I look for so many more things that we can do together. Every time you put a picture on there on what you're doing, I'm sitting there. That's my twin. That's my twin. And and you know what? Nobody has ever asked us about that. We say it all the time. Here's my twin. Here's my twin. And nobody has stopped to say, well, how was she? We've been waiting, but nobody.
No, nobody. You're right. You're right. But now the secret's out. Now people know why we call each other twin, and I think that's great. You know, I remember back when you invited me onto your radio show, and at that time, we were talking about breast cancer. I think the first show was when we were in the anthology together. I do know that. And at that time, you never shared with me that you had breast cancer. I didn't know that. And then I went on your show, and I don't know exactly when, if it was before we did the show on breast cancer awareness or after, but I was shocked to learn when you shared that you had breast cancer. And, I guess I don't know if I've ever asked you this. Why was it that you did not, when you even knew in the anthology my chapter was about my breast cancer, why you never shared that with me or why you waited?
Ashamed.
Mm.
I That's something that was so personal. and the looks and the stares. And I am now trying to come to grips with saying it out loud because my journey has been such a long time. Since I was 19, I've been going back and forth. But I never had to get the other things that everybody else's had to do. I never had to have radiation. I never had to have chemotherapy. And so when I say something, this one lady said to me, "Oh, you really didn't have it. You know, if you didn't go through this and this." So I just shut up. I mean, it's such a personal disease. It's so personal. And I have just in uh, one particular time, I had maybe, and I might be off with the numbers because I try and block it out. But in one breast, I had about 58 cysts. And then the other one, it was like 40 something cysts. And the first doctor that I went to, he said, "Well, I'm just going to have to cut your breast off." I said, is it cancer?" He says, "I don't know. You want to cut my breast off and you don't know?" He said, I don't have time to just to be, digging around and whatever. And then when it all comes back, then we can tell you whether or not it's cancer or not. Oh, absolutely not. Oh, absolutely not. I ran out of that place. And that's when I just sat in silence. I just sat because he wanted to do a double mastectomy,
Mastectomy.
and you don't even know what the result. That was the scariest thing.
Mm.
I'm 19, 20 years old. I'm 21 years old. I'm 22 years old. And I was going through this alone. I had
Yeah.
no to talk to.
Mm-hmm.
How do you reach out to somebody and say,
Yeah. So why do you think that is? Why do you think now, earlier today, it came up in my memories in Facebook, your interview with your family when you were on with your family, and I watched it this morning. And you had your sisters on, and you were talking about that, and the talk was about how people didn't talk. They didn't talk about their health issues, even
"Mhm,
within the family.
right, right."
And again, do you think that's because of fear? Because of what do you think that is? Because it's so important. We know that it's important to know family history, right? We
Right.
need to know that because if we know that, then we can let our doctors know.
Hmm. I'm sorry.
So, oh, I'm sorry. I didn't mean to
It,
strike a chord there,
it,
but
it's okay. It's okay.
mhm, mhm. Yeah.
Um, I don't know how it is in your community, but in my community, you just don't talk about stuff like that.
Okay.
You just and that's exactly in your own family, mother and father and children. You don't talk about stuff like
Mm-hmm.
that. As a child, I remember trying to ask my elders things, and they would just tell me, "Go sit down somewhere." Because I've always been inquisitive, always been
Mm-hmm.
just, I guess you could have put a microphone in my hand when I was 5 years old because I love doing interviews. I love getting to the source, the root of it. And we were just met with, "Get out of here. You can't look elders in the mouth. I don't know if you know, what are you doing standing there? So
Mhm.
we were not allowed to speak.
Mhm.
Children are to be seen and not heard. So
Mhm. Mhm.
we didn't talk about stuff like
Didn't
that.
talk about it. Yeah.
No,
Yeah, I understand that because in my I'm Italian and my parents are immigrants from Italy, my whole family, and in our culture, it's the same thing. You didn't talk about your healthcare matters, amongst other things, and you didn't talk about. But yeah, and you didn't know. You just knew that person passed, but that was never talked about why they passed.
no,
And I remember very clearly when my father was diagnosed with colon cancer, he was very private about it. He didn't want anyone to know. And that was my first exposure to cancer and someone in my family. And I just thought, wow, that to me, I thought, how strange. Why wouldn't you want to at least tell your brother, right? At least tell your brother because you want them to know. Because I was in the healthcare field and I knew he needs to know. And I did convince him to tell his brother. And honestly, I hope that it helped save his uncle, my uncle, his brother's life. Because guess what? He went and got that colonoscopy and he had colon cancer.
oh my.
So we understand the value of it, and I hope, do you think, Dee, is now time has gone by? Has any of that changed in your culture?
Not really. Um, we're still very protective with that. Um, we can talk about more health challenges, but when we speak of it, we're saying it in the third party. Like I'm not talking about myself. I knew a girl and she did so and so so and so, and then if you ask a direct question, then she'll say, I wasn't talking about me. It was,
Mhm.
somebody I heard. I was in a beauty shop. I don't know why. Because I maybe it's because we associate something with what did you do wrong.
Mhm.
If you have any kind of cancer, what did you do wrong? They don't think to the fact that it's just something that you in your genes that didn't, measure up. If you get lung cancer, they're not going. They're going to say, "Well, you should have quit smoking." Maybe that person didn't even smoke. It could have been secondhand smoke. Colon cancer. What else would? How else could you avoid something like that?
Mhm. Mhm.
Any type of cancer, it's not by choice of the
Mhm.
person, but
Right.
we're so protective
No.
of,
Mhm.
yeah, we're so protective. We don't want to share that information. We have family reunions, but this was prior to the pandemic, prior to 2020, 2019. We used to have family reunions. And then you get to know who your brothers and sisters and your cousins, and then they share stories. We've lost that.
Mhm.
We've lost grandmother.
Mhm.
Grandmother held us together.
Yes.
It was grandmother's job. You go to grandmother's house on Sundays, and everybody would be cooking around the table and talking. I didn't like the separation. The women was in the kitchen and the man was in the living room, but, because I want to
Yeah.
be in the men because their conversation is more interesting. But we've lost that.
Yes. Yes, I agree. Same thing. Yeah, that's exactly right. And the women were separated. Same thing with me. But yeah, we have lost that. And unfortunately, whether it's just the changing of the times or as we grow, then obviously our family then passes and then it's just never the same. And I know that's definitely the case in my family, as you said, it's in yours. And yeah, it would be nice to get back to that. I think it would be nice, or but to understand, I think what's really important here is that we need to know family history, as far as health. And most breast cancers are not hereditary. Only 5 to 10% are. But that being said, you still need to know if you had a first degree relative like your mother, your sister, your daughter, your aunt. You need to know that because you need to do additional testing. Maybe you need to start your mammograms early. So it's very important to have these conversations with your family, because sometimes if you carry a family history, that would warrant earlier testing. And I think that's what's important. And that's why we need to have these conversations, even if it's at a get together or family reunion. Hey, what did, you know, uh, Aunt so and so die from? What was
Right.
that? Just because we need to be knowledgeable for ourselves and our families. We want to stay healthy, don't you think?
Absolutely. But
Mhm.
and what's so strange about me is going up, I don't know my father's history, but going up my mother's history, there's no history of this.
Right, right. Yeah,
And
and
so
that, go ahead.
yeah, so how would I be prepared for this? How do
Right.
I talk for this? How do I learn from this? It just I tease with my doctor, and I said, well, where did all this come from? I said, nobody else in my family. And he turned it around with me. He says, you're the lucky one
Mm-hmm.
because they can look at you for support.
Mm-hmm. Right. Yeah, for sure. I mean, the thing is that again, getting with breast cancer and just bringing awareness, you having it, like he said, you can bring the awareness. Me having it, I can bring the awareness. Again, the two greatest risk factors for breast cancer are being a woman and getting older. That's it. Those are the two top risk factors. Well, guess what? We both had those risk factors, didn't we? And every person, every woman has those risk factors. So, again, you can understand the importance of getting the screenings because I mean, we have the screenings. That's the other thing. Back when, before mammograms, okay, they didn't have those screenings, but we
No.
have them now.
Mm,
And, it's good to know that you can have these screenings. And the American Cancer Society says if you have no family history and, or if you should start your mammograms at 40, right? And I think that that's important. And I think again, October brings lots of awareness to, oh, I better go get that mammogram, because it's a reminder. I mean, I'm lucky that people do because they know I'm a survivor. They like to tell me, which I think is great. Hey, I'm getting my mammogram. Somebody told me that this morning. Oh my God, it's next week, you know, and that's great. I love to hear that because I feel like we're doing our job. We're getting out there. And again, because we don't know what really causes this, you will question it. Like you said, did I do something wrong? You want to know the answer, of course,
yeah,
just like how you said, you want to know the answer, but we don't know. And that's, I mean, we're going to keep on researching and doing all of it. And, I hope that one day we will know. And that would be, great to have that discovery. But, when you started going through all of this and when I was initially diagnosed, I had certain emotions. You sort of talked about your emotion of being embarrassed or not wanting to share, and that type of feeling. And I think some of my feelings, I was just really scared, you know. Of course, when you first hear that, and I can't even imagine with you, I would be horrified if a doctor just right out of the gate said to me what that first doctor said to you, which again, I would I'm glad that you didn't go with that doctor, right? Again, we have choices. You had a choice. Some people would have maybe just sat there and said,
oh,
"Okay," but
mhm.
you didn't. What did you end up doing?
um After I ran out, I called my god sister, and I was way out in Lakeside, mall. The office was out there, and she was at work in Detroit. And she just screamed and she said, "What? What did you say?" She says, "I'm on my way. I'm coming to get you. I'm on my way." And I was just screaming on the phone because I was just laying on the table alone in this room. Because he said what he said, and then just walked out of the room. And I'm going, "Wait, what? You want to do what?" And I just laid there and cried.
Mm.
Not a nurse came in. Nobody came to check on me. And I mean, I wet up everything that that white sheet, because the tears was just rolling down my eyes, because I had no conception of what he was saying to me. I just heard cut. You want to cut my breast off, and you don't even know if it's, oh my goodness.
Mhm.
It was the scariest time. And I still shudder when I see stories, horror stories on TV and on social media. And I try and make sure I tell people, you are not alone.
Right.
Reach out. You are not alone. You don't have to go through this by yourself. I know I had to do it by myself, but maybe it was a reason. And that's why I'm so boisterous now about it.
Mhm.
And
Yeah, I
that
know.
was that was such a horrible time. And I have the the thing, one of the things that hurt me really really bad also was going in there and having that test, and them taking my breast. Now I'm already in pain because they were just, it was just tender, and them shoving it into that machine on, and it's going eh, and they the healthcare workers, and I'm not going to say all of them, but the ones that I dealt with, they had no empathy. It was just like, this is another test, and let me hurry up and get you in and get you out, because I gotta go and on a smoke break. I got 5 other patients. My partner didn't show up or whatever. And it was just like, hold still. How can I hold still when this thing is smashing you? And I mean, it's steady, and you could just hear it, and you just go, at what point will this stop? And for some time, I didn't go back. I did not go back. I couldn't. It was so humiliating. And, after the test, they just get dressed and then they walk out of the room.
Yeah.
I don't want no sister, no girl, no cousin, no aunt, no stranger to ever feel like that again.
Mhm.
That is such a horrible time. And you need someone to hold your hand.
Yeah.
You need somebody to say, it's okay. I got you.
Wow. So what did you ultimately, after obviously you left that doctor and I'm assuming you sought out another doctor
Yeah.
to find out what was going on?
Yes. My god sister took me to her doctor, which was off out of the network. Um, and he said, "Oh no, that was horrible. Nobody should be treated that way." And he said, I'll take care of you." And so I think surgery was within a week or two. And he took the time and he took each one out. And so on one side, and you can't see it, because I am so heavily involved. But on one side, if I was to, disrobe, I have a knot that much mass gone out of my left side. Um, Not to try and horror anybody, but it's just my journey. They've taken off both nipples and they cut around, go in, dig out whatever, and then they attach the nipple back.
Okay.
That was a
Yeah.
journey, but
Right.
everything properly, everything is good.
Good.
You can't even see the scars.
Wow.
Um,
So that was good. So they got the cancer. They identified it that there was cancer, and they were able to take it out. And then that was your treatment. It was the surgery. Is that right?
yes, and I did not have to. I did not have to have any aftercare. Uh,
Okay.
Everything was good. But those little boogers, they grow back.
Oh, you get the cysts and things back. Yeah.
Yeah,
Hmm.
then the cyst comes back. But if you are vigilant with knowing your body, you can always stay ahead of it. You know, um, I so they want you to do your yearly mammogram. But even before that, you know, feel around, feel the difference. Have your partner feel around and feel the difference. Your body does talk to you.
Hmm.
It does tell you something's wrong.
Yeah, for sure. I've heard people that they've said their partner found their cancer, they found their tumor, and they're like, "What is this here?" And again, that it is very important. And if you do take the time once a month to, take just to feel and make sure, you can even Google breast exam, self breast exam, to get, to know what feels odd. And yeah, definitely get yourself to the doctor and follow your intuition. And I know we said that men get breast cancer too. And I've done a lot of advocacy work and met a lot of breast cancer patients, and I have met two men with breast cancer. One I actually knew personally, and it's the same thing for them. It's nothing different. Everyone has breast tissue, and including men, they have tissue in their chest, and it comes up the same way. It comes up the same way. They feel something's odd, and the testing is the same. They have to get a mammogram or the ultrasound to determine if they do have a can. They have to then get the biopsy. Same exact same thing. So again, just men should be vigilant too, about that. And I just sort of want to go back a little bit with just the journey in general, and the emotions that you go through. And for me, like I said, I was scared. Of course, when you hear those words, you have breast cancer, you think, I'm going to die. I mean, that's what you think. Because when you
Yeah.
hear the word cancer, that's what you think. And that was initially, I thought, my goodness, I was 50 years old when I was diagnosed. And I thought, wow, what's going to happen, and it was scary, and like you said, you feel alone. So I felt the same. It seems like there's a commonality of emotions through us. Most cancer patients, not even just breast cancer, but a lot of cancer patients say this about these emotions. Anxiety,
Mhm.
wondering how is this, I ended up having to have a lumpectomy and then have treatment with chemotherapy, radiation, oral medication. And, and then you have to trust your doctors. And I know
Yeah.
sometimes that's hard.
Yes.
And I know that comes up, you know, and then hopefully, once you get through it, and hopefully, like with you, and I hope, and with me, you realize that you did get through it and now you're on the other side,
Yes.
and you have a sense of appreciation for life and for everything in your life because you've had that thought that it may be all taken away.
Right.
So I don't, did you did you share? I mean, we talked about how you didn't want to talk about it, but once, uh, I know you have children. Did you share that with your children about the cancer and how did they feel?
Yes, I did share it with them because my son is the one that was taking me uh, to my doctor's appointments. And actually, it was him that started telling my journey. There was the pink race a few years ago, and he's out there with a sign talking about I'm walking from my mother, and I'm like, boy, are you crazy? And he got this sign out here, and he got a whole team walking for me, and I'm like, shh. I don't want nobody to know, you know. And it was really ridiculous. It really was. He was proud, and I get it, that my mother is a survivor. So he tells my story, and I don't know. It was, I just didn't want nobody to know. I didn't want them to look at me differently.
Yeah.
That's, you know, I didn't want to walk in a room and people go, shh, shh, she, I just didn't want that.
Mm-hmm.
That wasn't something that I wanted to share with the whole
Right.
world. I didn't want that sign.
You didn't
Yeah.
want the big sign, but that was great that he did that. Do you think now, have you changed your thoughts about sharing medical information or what you've gone through since this has happened to you?
Actually, it was um one of my guests that came on my show, Teresa Harris, and she was an advocate for Bras with Cause. And she's, I'm shooting the questions. I'm a great interviewer. And she says, Dee, why don't you come do this runway with us? I'm like, what do you mean? She said, come join my group and we model. And I mean, you're modeling with a bra. You're out in front of all these people.
Right.
You have on a bra. But I'm telling you, that group was awesome. And they changed my mind because it's not just something that they just do in October. They meet all year round and they call and check on you, and they have other things for us to do. And they are led by just a great group of women.
Right. Yeah, I
And you
would
don't
have
have
to
to ask,
say,
yeah,
right.
you don't have to explain how you got on your journey, how long you've been on your journey, what you're feeling. They just come on in,
Right.
and you can talk as you feel comfortable, because you don't want to lead in. I just see the Alcoholics Anonymous room, and everybody's sitting there. Hi, my name is Denise, and I've been,
Right. Right.
they like that at all.
Yeah. Oh, that's nice. And I would have to say that the breast cancer community, you do have a sisterhood. I would say I don't know if that's like it that in other cancers, but definitely in breast cancer, you definitely have a sisterhood. It's not, again, it's not a group that you ever want to belong to, but the fact that you have all of that support, I think is great. I think that it was great that you're able to, put that bra on, and I don't know if I could do it, but I'm so happy that you got that opportunity. And, sometimes you think we're talked about what, the similarities that we had. And honestly, I feel there's no accident that we met. I know there was no accident. I do believe in divine intervention, and I really believe that is what brought us together.
Yeah.
So,
Is there what was painful for you after you took it in and you knew, well, I'm not going to die. This is not a disease that's going to kill me.
mhm. Well, I wanted to, face it head on. So I wanted to get all the information. I took it in bits and pieces because it was too overwhelming, but I wanted to, face it head on, what I can do in order for me to get the best outcome. So I tried to do, everything the doctor told me to do. And, when the oncologist presented it to me, and said, you need to have a lumpectomy. You need to have chemotherapy with an antibody treatment. You need radiation. And after that, you need to take an oral medication. If you do all of this, you have a 5 year survival rate, 95% chance of surviving 5 years. So when he put it to me that way, I thought,
Okay.
you make the decision. You make the decision. And I know not everyone chooses all the things, but I thought, no, I'm going to follow this path. So once I knew the direction, I just really focused because that 95% survival, I thought, oh, if I do everything and I can make it to there, I think I'm going to be good. So that's what I focused on.
Okay.
Yeah.
Did you have any pain in your journey?
I would have to say after I had my lumpectomy, of course, I didn't feel when I was diagnosed, there was no pain in the tumor, anything like that. I couldn't even feel it. It was 1.7 centimeters in size. I couldn't feel the tumor, but after I had the lumpectomy, there was some pain, involved with that just because of the surgery.
Of course.
And later, when I had radiation, um, toward the end of it, there was some burning. And so I had some skin cracking that was sort of painful because it got raw. Um, but other than that, I think that was it. Yeah.
Okay. There's a term that I have heard all of this time, and it wasn't until last year with this group that I'm with that I finally got a straightforward answer, and it was metastatic breast cancer.
Mhm.
I kept hearing that, and I'm like, what? How is And in my mind, breast cancer is breast cancer, but what is that word? And that group that I'm with, they sat me down and took me step by step
Mhm.
to teach me the education.
Mhm.
Well, it started from this point, and now it has spread it to other parts, but it started in the breast.
Mhm.
And it's such a scary journey.
Yeah, it is. And
It's,
and and when you and again, that was taught to me by somebody who had metastatic breast cancer because again, when I was first diagnosed, I had no idea there was all these different types of breast cancer until I was diagnosed.
yeah,
And I thought, wow, there's, there's what I had, invasive ductal carcinoma, there's lobular, there's triple positive, triple negative. I mean, it goes on in different stages. And metastatic, just like you said, is separate where it spreads to other organs and then you live with breast cancer for the rest of your life. And I was educated on that. I really didn't understand it until somebody who had metastatic disease said, Josephine, it is so different from what you went through.
Hmm.
and I was glad that she explained it because yeah, that is very serious. You have to live with this for the rest of your life, where I can say right now I'm a survivor and I am cancer free as of right now, where
Yes.
unfortunately metastatic, they can never say that. And that does make me sad, and I'm glad that she educated me on it. And this Monday, I was at the Pistons breast cancer awareness, and I know you're a huge fan, and again, another metastatic breast cancer thriver was there. And again, I met her through social media, and she's a huge advocate. And just every time I see her, I'm just so happy because I know she's in active treatment, but yet she's getting herself out there. She's educating. She's showing, hey, I'm here. And so I just think that it's great. I think metastatic disease needs to show there should be more uh,
Yeah.
awareness on it. And yeah, I mean, that is, and I'm glad that they shared that with you and you got to, understand more about it. Yeah.
Yes. I mean, and now they're saying um breast cancer thrivers.
Hmm.
What they're changing the terminology, and I guess that would attract more people to stop and try and understand the difference.
Right. Yeah.
Thrive. You know,
Right.
uh, because when you say survivor, it still has a negative impact
Hmm.
uh, on the term.
Hmm.
But when you say thriver, that means, you know what? I got it. I beat it. And let's go.
Yeah.
Let's go.
Right. Yeah.
Yeah.
Yeah. You're right. Yeah. You're thriving. You're doing, thriving is a better word. I know sometimes we refer to the metastatic breast cancer people as thrivers. Um, and like you said, in a way, it is like that. I guess I never really thought of that, but you're right. It is the terminology and, things, and even Breast Cancer Awareness Month in pink. I know people who hate it. People who are some breast cancer um, survivors, patients, people that I know that have, are past their treatment and are, getting on with their life. They just want to get on with their life. This is a
Yes.
reminder. Again, I had never realized that until just recently. This is a reminder to
Yeah.
them of what had happened. And they don't want to remember that. They don't want to remember that time in their life. And I respect that. I respect that wholeheartedly. But I also respect the fact that October is a good reminder. They
Yes.
did such a good job with bringing awareness and knowing that pink is breast cancer awareness. I put pink in my hair in October. I wear pink almost every day just because I want to bring awareness. But I totally get, don't you think, why people wouldn't want to be reminded and really don't even like October because of that.
Yes. Yes. It gives me anxiety too. It still gives me anxiety as September is winding down. Here comes October. Okay, you got to face your challenges. You have to do that. You are an advocate. You are a survivor. You are a thriver. But I still get antsy and anxious about that.
For sure. I do too. And I get my yearly mammogram now in October. It fell now into October. And again, yes, you're just such a great advocate. Every day you're posting on social media, and that's wonderful, and just making us all aware. But I'm scared. It's a scary time
It
when
is.
I have to get that mammogram, and here I am, and I'll be really honest, here I am advocating, doing work, raising dollars, everything that I do, talking on it. But it is scary
It
to
is.
go and get that mammogram, especially in October. And
Mm-hmm.
in my head, thinking, what if, when I would go and get that mammogram and go, what would this look like if? And we always have that fear, whether
Yes.
it's in the back of our mind or the front of our mind, it's always there of reoccurrence. I mean, and that is real. And that fear is always there, whether it's not right to the forefront, but it
Uh,
certainly does come the day I get that mammogram. And I did say that this year in particular, because my mammogram was on the exact date that I was diagnosed 8 years
oh,
ago this year.
okay.
And when my husband was driving me down, I didn't want to say the words. And I just thought it in my head. What if? This is the exact same day. We're going up north. This is exactly what happened 8 years ago. And I couldn't speak the words. But after it was all done and it was all clear, and I saw the my provider, and we got back in the car, I had to tell Jim what my fear was. Yeah,
Mm-hmm.
yeah.
Yeah. It is so scary. When you walk into a room, do you feel as if everybody is staring at you?
Now, no, I don't. I know you've said that. Several other people have said that to me about staring at your breasts. Um, I haven't experienced it as much. Um, and so I don't. That I have not experienced.
I hope you never will.
Yeah, yeah.
If I had, if I don't play the lottery, but I'm in a lotto club with my union sisters and brothers. If I had the money, this is what I would want to do. Get a clinic just for survivors and thrivers. And I want it to be pink all the way around. I want it to be a celebration that you don't feel alone. I want you to pull up and there are doormans and valet that's welcoming you there. Hello, we're so glad to see you.
Hmm.
But that person is scared
Yeah.
and they need to feel you are not alone and we cherish your life.
Hmm.
I would do that. Ooh, I,
Ooh, that would be great. That would be a great place to go. I think that's a great goal. And I think that would be wonderful for sure, for sure. I really enjoyed us talking, finally getting together and doing this. I know we talked about it. And, if you want to go ahead and share whatever else you'd like to share, if you want to share any contact, any information, anything you're doing, why don't you go ahead and tell us.
well, on June 14th, I graduated with my doctoral degree
Hey.
in Christian education and theology.
That's so exciting. So exciting. Mm.
it and now everyone calls me Dr. DivaDee. I'm like, and every time they say it, I break out in giggles because I'm like, they're talking about me. And I wasn't able to make the journey. My school went to Florida, and I should be getting a community service award. And you know, ah man, my school, Kingdom University Institute, they are great. This one little part, when we went to graduation, they have a little bio about you, and they say, okay, our next recipient is blah blah blah, and they give just a short thing on you. When they came to me, my dean says, I want everybody to stand up. And then he stopped, and so everybody, the whole audience is standing up. And I could hear my daughter in the background. She's hollering my name. But it everything kind of just, just moves slow. And as he's reading this, he said one thing that I said, oh, he's talking about me. He said, her outreach is in the Bahamas, in Jamaica, in Aruba. She is known as DivaDee Worldwide.
Great. Wow. Nice.
It was like, oh my goodness. And I would assume my classmates all knew about this because they stood up immediately and they started clapping. So I'm clapping. Who are you talking about? And
Ah,
they're like, they're talking about you. No.
what an honor. What an honor. Oh my goodness. Such an
Oh,
honor.
yes. Dr. Deb, she does this every year with students. She takes a student and she molds them and grooves them. And she turns out excellent. She just turns out excellent. And I am so happy.
That's amazing. That is amazing. And here it's a perfect what I've said in the past is that again, cancer doesn't have to be the end. It can be the beginning to a whole
Yeah.
new life. Look what you've accomplished past all of that, right?
Yeah. Right, right.
It's awesome. That's incredible. I'm so happy. I'm so proud of you. Very good.
Thank you.
So proud of you. And I'm just proud that we were able to get on and
Get this.
discuss a little bit about our stories, about how we were connected and breast cancer. And my closing nugget of information is get your yearly mammogram. It could save your life. It truly did save mine. Anything
That's wonderful.
else?
I uh, and get your mammogram and tell somebody. Go with somebody. Share, share, share.
Right.
You see that they need help that they're not doing, they're scared. They are scared. So you take their hand and say, you know what, sis? I'll go with you. And go an hour early and just sit in that parking lot or sit in the lobby and just hold that person's hand and just keep telling them, I got you. I got you. I thank God for you every day. I do. You know how much I love you, twin.
I love you too. Thank you so much. And I thank everybody who joined us today. I thank you for this will be uploaded onto my YouTube channel and we'll be sharing it. And I hope that we helped somebody out there today. In fact, I know we did.
Yeah.
Thank you.
Yes.
Thanks.
Thank you. Mwah. DivaDee out.